everyone, I want to do an update on my oncologist appointment at the breast center. So you know my story. If you don't, my last appointment I had a mammogram, and 3D mammogram and an ultrasound, and they found some cysts in my breast, but they also found that I had very dense breasts. And if any woman doesn't know this and haven't had a mammogram, I would love you to do it because it could happen to you. So this is a normal breast. It is clear, it's fatty, it's normal, and if they see any cancer or any tumors, it'll show up white. This is category B. This is a little bit of dense, but you know, they can still see on the mammogram and stuff for tumors and stuff. Category C, it gets denser, so it gets more at risk and high risk of not being able to see tumors even on the mammogram, so they have to do MRIs. And it's category D. This is mine. Mine is extreme, and so even with mammogram and ultrasounds, they can't see nothing. So they have to do MRIs. So every 6 months, I have to do an ultrasound, mammogram, and an MRI. And so today's appointment, I am getting genetic testing. I just got my blood drawn. So my genetic testing does a lot of all the cancers. So they take my blood, they get down to my genes, and they see if I have any abnormalities in my genes. So they do all these cancers, all right here, and all these genomes they test for. So I suggest you to do it because, you know, at the end of the day, not only will, you know, show abnormalities for you, but for your kids and your kids' kids on out. It'll also protect them and tell them, hey, my mom had gene problems or blah blah blah, and you get the picture. So it's called My Risk. I would suggest you ask your doctor about it and see if your insurance covers it. So back to my story. So right now, with not having my genes tested right now, I am a 24.2% lifetime risk, which is a high risk. And so I can, in my lifetime, could have breast cancer, any type of cancer. When the genome testing comes back, my genetic testing, it'll tell how bad of a risk. So if it's over 40%, that means I have an option to take my breasts off. So I wouldn't have to worry about that. Of course, I don't have the rest of my body to worry about, but that'll be taken care of, and I have to do that risk thing. Thankfully, I have smaller breasts, so I'm used to being almost flat-chested anyways, and if it to save my life, so be it. But yeah, please, if you haven't had any testing for like mammogram for your breast, please do it.